Hello, my name is Emma, and welcome to my health policy presentation about surgical smoke evacuation. So for my identified topic, surgical smoke is an unavoidable product of surgical energy devices, and operating room staff members have been exposed to this for many years. These devices could include things such as cautery or lasers. However, surgical smoke has become a critically important issue due to health risks to the staff, and recent legislation across many different states mandates evacuation policies to protect workers. So for background and significance of the issue, the smoke is produced during electrosurgery and laser procedures, as I mentioned. It contains many harmful chemicals, different particles, viral DNA, and carcinogens. It is the equivalent to smoking 27 to 30 unfiltered cigarettes by inhaling this smoke throughout the day. Its exposure is linked to many different symptoms such as eye irritation, headaches, nausea, and potentially long-term risks as well, such as respiratory disease or even cancer. So protecting the staff is a safety and ethical obligation. As for landscape affecting the issue, for social aspects, the staff health, patient safety, and workplace morale. Economic, the upfront cost of the evacuation systems to be implemented versus the savings from reduced illness and staff turnover. For legal and political, the growing number of states mandating smoke evacuation, and so hospitals are facing compliance pressure. Up to 20 states have implemented evacuation policies. Missouri has, and yet Kansas still has not. Ethical-wise, nurses and surgical teams deserve safe working conditions, and there's a duty to prevent avoidable harm. So for policy alternates and options, option one would be voluntary adoption of smoke evacuation systems by different hospitals and surgery centers. Option two, state-level mandates that are requiring evacuation systems throughout all areas doing any sort of operations. Option three, federal legislation for nationwide standards. So the most viable would be the state-level mandates. It's realistic, enforceable, and it's already been proven effective in multiple states. Like I said, there's been at least 20 states so far that have enacted these policies, so we know we can do it and hopefully eventually get federal legislation and nationwide policies. Key stakeholders. So first and foremost, it would be the nurses and surgical staff. They're the ones with frontline exposure, and they could advocate for these policies. Hospital administrators, they would be involved as well because this does include budgeting and compliance issues. Patients and families. Obviously, when any patient or family comes into the hospital, they expect to be in a safe environment, including during any procedure. And then professional organizations. AORN is leading advocacy efforts. This is the Association of Perioperative Registered Nurses. They are always pushing for surgical smoke evacuation nationwide. And then legislators and regulators, state health departments, and OSHA. For potential advocacy strategies, grassroots nurse advocacy, letters, testimonials, petitions, hands-on demonstration for the legislators to show these smoke hazards and how they can affect people. Media engagements such as social media campaigns and coalition building with patient safety groups. And then professional lobbying through nursing associations such as the AORN. So overall, surgical smoke evacuation isn't optional. It's essential for staff safety, patient trust, and ethical care. Here's the infogram I have created about health policy for surgical smoke evacuation in Kansas. As you can see, Kansas ranks number 40 in physical environment, which is very low, and it is one of the states that has not enacted these laws, yet 20 states still have. Over on the right, I've included different health impact, exposure prevalence, and some of the toxic contents that are in surgical smoke. And then below that, some of the symptoms with percentages of how many people have been reporting these. Resources available, AORN, like I mentioned, they do have a program called the Go Clear program, which is an initiative to help hospitals eliminate surgical smoke. And then policy recommendations, we need to start with state legislation and then hopefully someday move to a nationwide policy that mandates surgical smoke evacuation in all operating rooms. Here are the references I have used for this presentation, and that is the end. Thank you so much for watching.